IMCI, okay? So full name now is CBIMNCI, Community-Based Integrated Management of Neonatal and Childhood Illness. Okay, everybody is hearing? Yes?
Yes, ma'am.
Yeah, okay, this is one of the community program in the children, okay? Sometime in the final year, they ask you question, what are the community-based program, do you know? You must have learned other program also in community medicine, so this is also one of it. So this is a community-based program, okay? So in this, as it is a community-based program, we try to focus on the common problem in the children so that we can decrease the mortality of the children below 5 years of age. Okay, so we'll go with it. When it started, what are the things we have done? Have you done this in community medicine? IMCI? भइसक्यो?
हजुर हजुर
भनेपछि तिम्रो रिपिटेसन भयो?
हजुर म्याम
पुरै पढाइसक्यो
हो तर 4th सेम मा हो म्याम
ओके अनि यसको नोट्सहरु छ
छैन
मैले यहाँ रेकर्ड राख्दै छ है राख्दाखेरि हुन्छ है कहिले यु गेट द शॉर्ट नोट अन कम्युनिटी मेडिसिन IMCI है त ओके so we go quickly with it then okay so under 5 years children about 1 lakh people die every year so this program is focused mainly in under 5 children because under 5 mortality is high so 7 out of 10 death is due to this 5 diseases ARI is pneumonia diarrhea malaria measles and malnutrition if somebody asks you what are the diseases included in IMCI भन्यो भने पाँचवटा disease भन्नुपर्छ okay all of you pneumonia diarrhea measles malnutrition and malaria okay so certain thing you have to remember so these are the conditions which are continue to be the major cause of death if no effort has been taken that's why to meet this challenge, WHO and UNICEF started IMCI in Nepal in 1995. So started in 1995. In 1997, they call it that community-based IMCI. In 2009, so this IMCI is covered in all over our country. Okay, and in 2018, initially in this IMCI, newborn is not included. Right? पहिला कति age देखि कति age सम्म include हुन्थ्यो भन? Before newborn was included, how much age of the children is included in IMCI? कसैले भन? Which age group? भन न भइसक्यो हैन क्लास? कोही पनि बोल्दैन त के हो? Anybody, even if it's wrong, you can tell भन. सुनिरहेछ कि छैन? सुनिरहेछ कि छैन?
1 to 5 years.
कति to 5 years?
सुनिरहेछ. 1 to 5.
होइन. Up to 5 years is right. Below is 2 months. Okay. पहिला चाहिँ 2 months to 5 years को children include हुन्थ्यो. Before this newborn was included. Newborn भनेर थाहा छ है. Up to which age group is newborn? From birth to कति हो? Newborn भनेर थाहा छैन? कति हो? कहिलेसम्मलाई न्यूबॉर्न भन्ने pediatric सुरु भएपछि थाहा हुनु पर्यो नि बोल न so many students are there even if you are wrong is no problem भन न्यूबॉर्न भनेको कति एज ग्रुप सम्म तिम्रो नबोल्ने भए त म पनि नबोल्ने भन
28 days
Yes, so up to 28 days is newborn, right? So before newborn was included, only 2 months and above children was included in community medicine. Now after newborn has been included, so since birth, this is included, okay? So CBIMCI and CBNCP program was integrated. Newborn childhood program combined, they made it CBIMNCI in 2014. So now newborn is also included, right? So up to less than 5 years child since birth is included in CBIMNCI. Kalka questions also, what is the difference between IMCI and IMNCI? Newborn is included, right? So IMNCI included newborn care included essential newborn care, counseling, breastfeeding, newborn complications like breathing problem at birth, neonatal sepsis, neonatal jaundice, neonatal hypothermia, low birth weight, preterm baby. So it's a newborn program. You included here. Include. Okay. Previously, only 5 diseases were included. Now, in that also, this newborn diseases are now added. So now it is imci, another imci. So from child 2 months to 5 years, you pass to disease. Malaria, measles, diarrhea, pneumonia, malnutrition. So these 5 diseases plus newborn program is included in imci. IMNCI and you say IMCI. Duita milaera combined bhayo. CB IMNCI bhayo. Okay. So this program is actually targeted for the lower level of the health staff because we want to cover all over the country. So big program is not there. So main diseases are included and all the health workers are included. Not only doctors, nurse, healthcare worker, sabai included. So first level healthcare staff are included because you will not have doctor, you will not have a big hospital, and people will go to the healthcare level. Okay, so in that place, this nursing staff and first level health worker or if you train, so they will find out which child is very sick. So this child will not go back home. So either they will admit there. If they cannot admit there, then they will send to the bigger hospital. So we will not miss the cases even in the village. So this program is focused not only to the doctors, all the lower healthcare staff, because we want to detect a common problem, simple problem. Because of that, the child are dying. So here, no big complicated program is included. So case detection is done using the simple clinical science. Empirical treatment are given according to the classification orientation. So IMCI gives guideline to look for danger sign. So we want to detect a child who is very sick. They should not go home. Okay. So we'll ask about the question about the common illness and examine the child. Then classify the child according to the illness and group it into the very sick, less sick, and not normal, yellow, pink, and green. Green means some simple remedy. With that, the child can go home. When it falls in the yellow, it means he needs some medication. And pink means very sick, cannot send home, must be admitted or referred to the hospital. So we identify specific treatment for what is the problem we find out. Then we assess for child's nutrition, anemia, immunization. Then if we are sending child home, we counsel the parents how to give medicine, when to know the child is sick, when to come back, and how to follow. Okay, so this is basic in IMCI. So component of IMCI, question also, what is component one? Improve in case management skill of the health staff through the provision of locally adapted guidelines on the IMCI. So it's my guidelines paper, so just apply. Improvement in health system required for effective management of childhood illness. Improve family and community practice. Sometimes community wrong practice are going around. Sometimes previously, long ago when there is a diarrhea, गाउँमा के भन्छ बच्चाले पानी दिने भन्छ नदिने भन्छ भन न सुनिरा हो Bola, you are hearing or not?
Yes, ma'am.
So previously, what was the practice when there is a diarrhea? Fluid dine bhantyo ki nadine bhantyo? Pani khawnu hudaina, jhol khawnu hudaina, हैन? So they used to die with dehydration. Now this practice has changed. We have to give ORS, we have to give a lot of food. So these type of community practices we want to change. So IMCI does not include the guidelines for major illness, chronic problem, less common problem, trauma, acute emergency. हामीले चाहिँ फोकस गरिरहेछ जुन कुराले चाहिँ चाइल्ड डेथ भइरहेछ अन्डर 5 त्यसैलाई मात्र फोकस गरिरहेछ सो सबै इलनेस अनकमन क्रोनिक ट्रमा इमर्जेन्सीहरु यसमा इन्क्लुडेड छैन So management we have divided IMCI into two groups, child from birth to 2 months and from 2 months to 5 years. यसमा दुईटा अलगै पेपर हुन्छ सो अप टु 2 months कसरी अप्रोच गर्ने from 2 months to 5 years अप्रोच कसरी गर्ने जब बच्चा आउँछ पहिला तपाईले तिमीले चाहिँ एज ग्रुप छुट्याउनु पर्यो कति मन्थ सम्म भनेर and according to that we'll have different plan. So sick child from 2 months to 5 years how you approach पहिला एज सोच्नु पर्यो अनि कुन ग्रुपमा पर्छ डिवाइड गर्नु पर्यो then we'll grow accordingly. So now we are doing 2 months to 5 year old child. So बच्चा आउँदाखेरि first You assess, then you classify कुन ग्रुपमा पर्यो अनि किन आयो त बच्चा, what is the main problem सोध्नु पर्यो. Then for all the problem who come to you, we always look for the danger sign, general danger sign. यो सबैलाई सोध्ने, चारवटा danger sign छ, सबै बच्चालाई सोध्नु पर्यो. If this danger sign is present, that means child is very sick, this child fall in the red group, he cannot go home, he must need admission in your hospital, and if there is no admission facility, you have to refer the child for the admission. So what are the danger signs? Your question or danger signs are not being able to drink or breastfeed, vomits everything out, convulsion, lethargy, or unconsciousness. Whatever may be the illness, child is very sick. Right? So this child needs urgent referral. Then classify the child's illness using the color code. So use the child will fall in the pink one. Use China, but it's all signs symptoms. So there you have to see whether he fall in the yellow one or the green one. So then you will ask for the main 4 symptoms: cough, difficulty breathing, diarrhea, fever, air problem. So 4 main symptoms and 4 danger signs. So then after asking all this, we'll also look for this nutritional status. Nutritional status like height, weight, hair circumference, mid-arm circumference, anemia, immunization, and any other problem the child has. Then if you are sending the child home, we counsel and ask for the follow-up. So we go to the main symptoms. Suppose the child says the child has a cough. Now we'll try to find out what is the problem, how severe is the cough. Cough pneumonia. So with few questions and few simple examination, we'll try to find out child has just simple cough or has pneumonia or severe pneumonia. Okay, so if child has cough, then we'll ask for how long, right? We have already said if it's a chronic problem, it's not included, right? So if the cough is for more than 1 month, it's a chronic problem. So we'll not include that in this one. Then more than a long time chronic cough will cause maybe the tuberculosis, asthma, some complicated problem. So these are not included in IMCI. So if it's chronic cough, then this will not come in IMCI. So you have to ask for the time. Then you examine the patient, count the breath for 1 complete minute, look for chest ingrowing, look for the stridor, then classify how sick the child is. Okay. If the child has no cough, then you ask for other symptoms. So if mother says difficulty breathing, what do you understand is any unusual pattern of breathing is difficulty in breathing. Cough more than 30 days is chronic cough. So this will not be included in the IMCI. Then you know the fast breathing. You know the pneumonia 2 months to 12 months, 50 times or more, 12 months to 5 years, 40 times or more. So if this is there, then it's a fast breathing. So always count for 1 minute, right? Respiratory rate. And look for the stridor. So stridor is a noisy sound which is produced due to the obstruction in the upper airway. Right? Upper airway bhaneko pharynx, larynx, trachea, epiglottis. So this is the upper airway. Any obstruction in this part, you will hear the noise that is called stridor. Right? The stridor and wheeze good difference. Right? Wheeze is a when there is obstruction in lower airway, you hear abnormal sound that is wheeze. Okay. So stridor in calm child is dangerous. Okay. So this pneumonia classification you have already done. Okay, na bhana ta? Pneumonia bhayo timarko? Anybody? Pneumonia bhayo? So your classification So according to examination, if the respiratory rate is not high, only cough is there, that is no pneumonia. Right? So in that one, you will give some symptomatic treatment and send child home. If respiratory rate is high, but others difficulty breathing and all is not there, child has pneumonia, in such case you give some oral antibiotic and send home. And if severe sign like chest ingrowing, stridor, grunting is there, child has severe pneumonia, so this will fall in the red group and he need admission. Okay, so next symptom is diarrhea. Again, you ask why the child has come. Then child say that the mother says the child has diarrhea. Then you ask for duration, how long. Again, you know the diarrhea. There is a acute diarrhea, chronic diarrhea, persistent diarrhea. You differentiate गर्नुपर्छ. And you ask whether blood is there in stool or not. You ask for the danger sign, look for dehydration, then classify diarrhea. Dehydration classify गर्नुपर्छ. Okay, when somebody say what is diarrhea, is when stool contains more water than normal, this is diarrhea. किनभने सानो बच्चामा 2-3 टाइम पनि normal हुन सक्छ. So consistency is different and more than 3 times per day is diarrhea. So according to duration, less than 14 days is acute diarrhea, more than 14 days is persistent diarrhea. Blood in stool, now your classification will be dysentery. So this is how you will classify the diarrhea. Now you look for the sign of dehydration. So look at the eyes of the child, whether it's shrunken or not. So in such case, you ask the mother, do you think your child's eye is normal? Mother when your mother is it may be normal, and mother will tell no, so then you can make it out that child eye is shrunken. You can assist yourself, and in confusion, you can even ask your mother of the child. Then offer the child fluid. बच्चालाई थर्स्ट छ कि छैन कसरी हेर्ने जाँचमा सोध्छ तिमीले डिहाइड्रेसनमा थर्स्ट प्रेजेन्ट एब्सेन्ट भन्छ कसरी थाहा पायो थर्स्ट भन्यो भने तिमीले चाहिँ बच्चालाई फ्लुइड अगाडि ल्याएर देखाउनु पर्छ offer the child fluid and then look for the reaction of the child बच्चाले पानी खान खोज्दैन भने there is no thirst, he is very eager to drink, child is thirsty, अनि पानी मुखमा हाल्दै पनि बच्चाले खानै सक्दैन भन्यो भने he drinks poorly, right? That is very sick. Then you examine for the skin pinch. Right? Does go slowly, very slowly, or normal. So skin pinch where you examine is between the umbilicus and abdominal wall. Right? That's a good number. Then you classify dehydration. Right? Your dehydration classification is no dehydration, some dehydration, severe dehydration. Up skin pinch, thirst, shrunken eyeball, lethargy, irritable, kissa. No dehydration छ भने ORS दिएर you send child home, मदरलाई ORS कसरी बनाउने कसरी खाने सबै सिकाउनु पर्छ न त उनीले प्रिपरेसन गरेको रङ हुन्छ नर्मली के गर्छ सानो बच्चा छ भने एक प्याकेट 1 लिटरमा बनाउँदैन थोरै ग्लासमा थोरै ORS बनाइदिन्छ if they do like that it will be very dangerous सोडियम पोटासियम को कम्पोजिसन रङ हुन्छ कहिले हाइपरनाइट्रिमिया कहिले हाइपोनाइट्रिमिया यस्तो प्रब्लम आउँछ so always when you give medicine that you have to counsel so counseling is also one of the important part in IMCI so if child is restless irritable shrunken eyes drink eagerly, skin pinch goes back slowly, then some dehydration. So in this one also, you give certain amount of fluid. Plan A, B, C dehydration. If severe dehydration, lethargy, shrunken eye, cannot drink, skin pinch goes very slowly, child needs admission. Okay, next symptom problem is fever. Again, ask the child. What is the problem? And it fever so main cause of fever here we are focusing is in like malaria, neck stiffness, meningitis, and other cause. Okay, so we cannot miss the meningitis and malaria. So you decide where the child come from. Malaria risk zone. I know malaria high risk zone, low risk zone, no malaria risk zone. And you should have certain idea which place like malaria is high, right? And you look for the neck stiffness always. When there is a neck stiffness, means child is very sick, maybe having meningitis, so he will always fall in the red zone, he cannot go home. And look for the running nose, right? So mainly we are focusing from malaria, meningitis, and measles. Running nose, rash, red eye, so fever, when you say is temperature more than 37.5 degree or more. So fever can be due to malaria, measles, and meningitis. We are focusing in mainly few disease, common disease, important disease. So when you say malaria high risk, more than 5% of fever in that area is due to malaria. Low risk is less than 5% people have fever with malaria. No risk for malaria, like in Kathmandu itself, or some malaria. So this is how you classify. So you classify fever in the malaria risk zone, very severe disease. In this one, if the child has come from malaria risk zone, you look for the danger sign, neck stiffness, and always give quinine for malaria, antibiotic दिने अनि admission गर्ने अनि malaria मात्रै छ भने चाहिँ no cough anti-malaria दिने cough छ भने cotrimoxazole दिने है त paracetamol दिने अनि घर पठाउने अनि malaria low risk zone बाट आएको छ भने again look for danger sign हुने बित्तिकै antibiotic दिएर admission गर्नु पर्यो malaria को treatment दिनु पर्यो no running nose measles हरु होइन जस्तो छ malaria छ भने चाहिँ anti malaria दिएर घर पठाउनु पर्यो running nose हरु छ भने you think malaria is less likely so it may be measles है अनि paracetamol दिएर घर पठाउनु पर्यो so now classification of the measles हैन measles मा severe complicated measles हुन सक्छ measles with mouth and eye complication हुन्छ simple measles हुन सक्छ हैन severe measles कहिले भन्ने general danger sign भयो भने clouding of cornea भयो भने oral ulceration deep भयो भने so here when there is a measles always give vitamin A and give antibiotic है and measles ma pus from eye mouth ulceration छ भने vitamin A tetracycline eye ointment mouth ma Jensen violet दिनु पर्यो and measles now and within 3 months भने vitamin A मात्र दिनु पर्यो so another problem another main out of 4 important sign one is ear problem which we have included so ear problem ma चाहिँ tender swelling behind the eye ear कानको पछाडी swelling छ भने we think it's a mastoiditis so antibiotic दिनु पर्यो cetamol दिनु पर्यो है pus discharge less than 14 years छ भने acute ear problem भयो so you give antibiotic for 5 days paracetamol and dry ear राख्ने भन्नु पर्यो more than 14 days छ भने चाहिँ chronic ear infection just give ask for the dry ear and ear ma problem छ भने चाहिँ no ear infection no treatment so these are the 4 main problem fever ear problem then the diarrhea then cough right then after asking all these always all the time you ask for immunization because before the first birthday they should get all the immunization which they have missed के गर्छ एउटा दुटा immunization दिएको हुन्छ अनि अर्को हुँदैन जुन vaccine mix भएको छ you can give it at any time right if the child does not come for immunization and the recommended is give the necessary immunization any time after the child reaches that age there is no actual contraindication for immunization if the child can well enough to go home already ruga khoki diarrhea छ भने immunization गर्नु हुँदैन if the child is very sick and child need admission only in such condition you give no vaccination है त so 3 contraindication for immunization ल BCG कहिले दिनु हुँदैन भने if the child has AIDS है because BCG is a live vaccine यस्तोमा AIDS मा BCG दियो भने यसले tuberculosis flare up गर्छ है त so no BCG if the child has HIV AIDS do not give DPT to the child who had convulsion or shock within 3 days of the recent dose do not give DPT to the child which has a reconvulsion neurological disease so these are the contraindications सुनिरहेछ है सबैजनाले सुनेको छ
हजुर सुनिरहेछ
बुझेको छैन के प्रब्लम छ भने you can ask in between है no problem okay now we are coming from a child from birth to 2 months hey okay sick young infant up to 2 months hey assist the child and classify the illness ask about why this young infant has been brought and check for possible bacterial infection and classify illness so यसमा चाहिँ approach completely different छ possible bacterial infection छ छैन त्यति मात्रै अब जस्तो pneumonia malaria measles भन्नु पर्दैन यसमा चाहिँ bacterial infection हुन सक्ने possibility छ छैन त्यो मात्रै okay so ask about diarrhea if present assess the further sign check for feeding problem low birth weight check for immunization status and any other problem okay so possible infection थकी छैन कसरी थाहा पाउने त भने so when you ask for this sign है त convulsion छ fast breathing छ chest indrawing छ nasal flaring grunting frontanelli bulge है so frontanelli कहिले क्लोज हुन्छ भन त anterior frontanelli which age group it closes anatomy पढेको भन बोलो न कोही
18 months
yes so before 18 months child, when they come to you for fever, you are thinking of meningitis, always feel for frontality. So this newborn also you have to feel for frontality. Newborn meningitis you will not get neck stiffness, vomiting, typical feature. Look for the frontality. If frontality is buzz, always think that the child has meningitis, unless and unless you can prove with doing the lumbar puncture. And you look for the pus drainage, you look in the umbilicus, umbilical redness, discharge, skin, skin pustule, child is lethargic, unconscious, child normal movement, less movement. Sano bacha ke huncha hatta chalaera all the time they are moving, now आँखा खोल्दाखेरि पनि नसुत्दाखेरि पनि if child is not moving, these are the danger signs. So यिनीहरु कुरा भयो भने चाहिँ the child can have a serious bacterial infection. So the child is sick, now this child will not go home, you have to admit the child. So you give the antibiotic, then you give either admit in your hospital, and if you cannot admit in your hospital, you need the referral. This child cannot go home. Okay. Out of that, if this thing is not there, child has some skin pustule, some redness in the umbilicus, this means local bacterial infection. So you give some local treatment, oral antibiotic, and you send home. So always when you send home, mother like औषधि दिएको छ भने कसरी खुवाउने, how much you have to give, how you prepare, कति दिन खुवाउने, अनि कति दिनमा राम्रो भयो भने कतिखेर आउने, follow up, everything you have to counsel. So counsel is also very important part of IMCI. Okay, so sick problem छ कि छैन हेरिसकेपछि, then we have to look for the feeding problem in the low birth weight, because malnutrition is also the one of the thing we have included in the IMCI. Assist for breastfeeding, सानो बच्चालाई चाहिँ at least 8 times a day you should be feeding. मदरलाई सोध्नुपर्छ कचोरी खुवायो भनेर, at least 8 times they have to feed in 24 hours. And for breastfeeding correct रूपमा गरेको छ कि छैन भनेर you have to look for the attachment and positioning. Breastfeeding मैले पढाइसके है, attachment and positioning. Breastfeeding मा पढायो कि हैन?
Oh man.
Okay. फेरि पनि मैले भनिरहेको छु. So there should be proper positioning, there should be proper attachment for the proper breastfeeding, successful breastfeeding. So this thing I have already said, in proper positioning, baby should be straight with neck and body straight, baby turning to our mother, baby close to our mother, and baby's whole body should be supported. This is position. And attachment, chin should be touching the breast, mouth should be wide open, lower lip should turn outward, and more areola visible above than below. Yo चाहिँ तिम्रो भाइभा क्वेशन है, फाइनलमा पनि सोध्छ ब्रेस्टफिडिङ. सो कहिलेकाहीँ चाहिँ तिमीले अब बच्चा वेट गेन भएन भनेर लिएर आयो भने त्यही अगाडि राखेर मदरलाई फिड गराएर हेर्नुपर्ने पनि हुन सक्छ, प्रपर पोजिसनिङ एट्याचमेन्ट छ कि छैन भनेर. कहिलेकाहीँ रङ पोजिसन एट्याचमेन्टले गरेर प्रपर न्युट्रिसन नभए हुन सक्छ. ओके, एन्ड अब नाउ वी आर कमिङ टु द रिफरल. We have said that if child is very sick, we have to either admit the child or we have to refer. So refer गर्ने भन्ने बित्तिकै के हुन्छ, काठमाडौँ भित्र त short distance हुन्छ, काठमाडौँ बाहिरबाट तिमीले refer गर्नु पर्यो पेशेन्टलाई भने it takes long duration. So before referring, what are the things you have to keep in mind? Okay, for infant up to 2 months of child, always give first dose of antibiotic. Right? Refer गर्नु अगाडि एउटा एन्टिबायोटिक दिएर पठाउनु पर्यो, because during the time of the referral we are taking certain hours, so within that hour child may deteriorate. So first dose antibiotic when you are referring the child you have to give in the same place. So up to 2 months child IM antibiotic, gentamicin and penicillin दिनु पर्यो. On the way, advise the patient, the parents to keep the child warm. Newborn छ भने चिसो बनाएर लग्यो भने हाइपोथर्मियाले त्यहाँ पुग्दासम्म त्यो मरिसक्छ. सो कीप वार्म, कसरी वार्म गर्ने सिकाउनु पर्यो. ब्रेस्ट फिडिङ सुकाउँदै लानु पर्यो, नत्र हाइपोग्लाइसेमिया हुन्छ. डायरिया छ भने ओआरएस अन द वे दिँदै लानु पर्यो, ब्रेस्ट फिडिङ गर्दै लानु पर्यो, नत्र 3 घण्टा 4 घण्टापछि चाइल्ड विल बी फर्दर डिहाइड्रेटेड. So referral, pre-referral management. So the pre-referral for 2 months to 5 years, यसलाई पनि प्रपर एन्टिबायोटिक दिनु पर्यो. मलेरिया सस्पेक्ट छ भने क्विनिन त्यही दिनु पर्यो. मिजल्स सस्पेक्ट छ भने फर्स्ट डोज भिटामिन ए त्यही दिनु पर्यो. एन्ड अन द वे कसरी चाहिँ सुगर लो नगर्ने त हैन, आइबी फ्लुइड दिन मिलेन भने ग्लुकोजहरू ओरली दिन मिल्छ कि समथिङ हैन, यु हेभ टु म्यानेज. सिटामोल चाहिँ ज्वरो छ भने दिनु पर्यो. एन्ड डायरिया छ भने ओआरएस अन द वे दिँदै लानु पर्यो. सो दिस इज प्री रिफरल म्यानेजमेन्ट है. सो नाउ That was the sick child, very sick child who needed admission. Now this one is the child who is not sick, who falls in the yellow group, he will go home. So उसलाई चाहिँ अब के antibiotic दिने त हैन IMCI मा. First line antibiotic is cotrimoxazole, second line is amoxicillin. For malaria, first line is chloroquine, second line is fancidar, sulfatoxin and pyrimethamine, right? Okay, so child has diarrhea, you will group in the plan A, B, C according to dehydration. यो तिमीलाई थाहा छ है. Plan A भयो भने घर पठाउने कति ORS दिने, B भयो भने घरै पठाउने how much ORS you have to give. Plan C मा चाहिँ you have to admit and you have to know how much IV fluid you are giving. So यो diarrhea मा पढाइसके तिमीलाई. Now counseling, right? You are sending child home. What are the things you are counseling to the parents, right? So feeding problem भएर आएको छ भने 5 days पछि बोलाउने. बच्चा पिएल छ भने you are giving iron supplementation, कसरी iron बढाउने भन्नु पर्यो. Asked to come back after 14 days. लो बर्थ वेट भएर आएको छ भने अघिको न्युट्रिसनहरुको हिस्ट्री लिनु पर्यो. ब्रेस्ट फिडिङ सानो बच्चा छ भने हिस्ट्री लिनु पर्यो. कसरी न्युट्रिसन गर्ने भनेर काउन्सिल गर्नु पर्यो. हामीले न्युट्रिसन पढाइसकेका छ तिमीलाई. कसरी क्यालोरी दिने घरमा हैन, फ्रम होममेड फुड ओन्ली, हाउ टु गेट एडिक्वेट क्यालोरी भन्ने हामीले पढाइसकेका छ. त्यो सबै काउन्सिलिङ गरेर घर पठाउने. बट यु कल ब्याक ओन्ली आफ्टर 1 month, किनभने 2 दिनमा आएर उसको वेट बढ्दैन, राइट? सो यसरी खाने यो खाने भनेर पठाएर अनि यु फलो इन एभ्री 1 month यु टेक द वेट. ओके, अनि कहिले चाहिँ इमिडिएटली कम ब्याक गर्ने त घर गएर के प्रब्लम भयो भने इमिडिएटली आउनु पर्छ. अप टु 2 months चाइल्ड हैन, ब्रेस्ट फिडिङ एन्ड ड्रिंकिङ पोरली, ब्रेस्ट फिड गरेन अथवा ड्रिंक गरेन हैन. इफ द चाइल्ड डज नट ब्रेस्ट फिड, वाट एभर मे बी द कज, चाइल्ड इज, यु हेभ टु एज्युम चाइल्ड इज भेरी सिक and child need admission, है. मदरले तिमीका लिएर आयो, बच्चाले दुधै खादैन भन्यो भने वाट एभर मे बी द प्रब्लम, चाइल्ड इज भेरी सिक, अलवेज टेक इट, अलवेज किप इट माइन्ड है त. दुध खान्छ कि खाँदैन सोध्ने, यो बच्चाले त दुधै खाएको छैन भन्यो भने चाइल्ड इज भेरी सिक, वाट एभर मे बी द अन्डरलाइन कज, एन्ड बिकम सिकर. पहिला भन्दा घर लगेपछि सिक भयो भने तुरुन्तै आउनु पर्यो, कुरा मिलेन. डेभलपिङ फिभर, फास्ट ब्रिदिङ बढेर गयो, difficulty in breathing भयो, blood in stool भयो भने now you cannot wait, you have to come back immediately. अब green zone मा परेको बच्चा अब you might have falling yellow zone or the red zone. So यो condition मा चाहिँ आउनु पर्यो भनेर मदरलाई काउन्सिल गर्नु पर्यो. Okay, and 2 months to 5 years child, any sick child again not being able to drink or breastfeed, become sicker, develop fever, यो condition मा पनि फेरि आउनु पर्यो तुरुन्तै. चाइल्ड विथ नो न्युमोनिया घर गएपछि फास्ट ब्रिदिङ भयो, सास फेर्न गाह्रो भयो. तिमीले ग्रिन जोनमा पढेको न्युमोनियाको के अरे कफको पेसेन्ट घर गएर डिफिकल्टी इन ब्रिदिङ भयो, फास्ट ब्रिदिङ, छिटो सास फेर्न थाल्यो भने फेरि आउनु पर्यो. चाइल्ड विथ डायरिया, त्यसमा ब्लड देख्न थाल्यो स्टुलमा, उसले ओआरएसहरू मुखले खानाहरू खान छोड्यो भने इमिडिएटली आउनु पर्यो. सो दिस आर द कन्डिसन, child has to come back immediately. Okay, and if everything is okay, then when you send home, then you have to tell for immunization kaile aune त्यो बुझाएर पठाउनु पर्यो, otherwise they will not come. So our main focus is not for the higher disease, not for the complicated chronic disease. So this is for the common disease in the community level. We are trying to prevent the mortality of the under 5 child due to the common problem. So IMCI is for the common problem for less than 5 years old child. We are trying to prevent the under 5 mortality. So this can be applied not only in a big hospital by the higher specialized doctor. This is by general doctor, like just like तिम्रो भुलपछि intern हुन्छ, internले तिम्रो medical officer हुन्छ, तिमीले even the sister or the health worker, सबैलाई चाहिँ which one child is very sick भनेर डिटेक्ट गर्नको लागि गरेको बेसिक प्रोग्राम हो. हैन, चाइल्ड सिक छ भने दिस चाइल्ड आफ्टर सीइङ बाइ यु or the first level health care staff should not go back home. हैन, हस्पिटलमा आएर एडमिसन भएपछि उसले फर्दर ट्रिटमेन्ट पाउँछ, अरू नभएको एक्जामिनेसन पनि हुन्छ, अदर ट्रिटमेन्ट हुन्छ. सो वी क्यान प्रिभेन्ट द मोर्टालिटी अफ द चाइल्ड. ओके, सो दिस इज द मेन एम अफ द IMNCI. I think this much easy. Can you questions, sir? Any questions? छ कि छैन? छैन भने छैन भन, बोल न, कोही त बोल.
छैन म्याम.
ओके, योलाई मैले रेकर्ड गर्दैछ हैन. यो IMCI चाहिँ लामो च्याप्टर हो. मैले चाहिँ समराइज गरेर तिमीलाई मेन चाहिने मात्रै यसमा राखेर चाहिँ बनाएको हो हैन यसमा तिमीलाई भाइभा क्वेशन पनि कभर हुन्छ रिटन क्वेशन पनि कभर हुन्छ यति भयो भने है मेन कुरा थाहा पाउनु पर्ने मैले भने है तिमीलाई आइएमएनसीआई र आइएमसीआई भने के हो यसको हिस्ट्री थाहा हुनु पर्यो कहिले स्टार्ट भएको कहिले हाम्रो नेपालभरि कभर भएको हिस्ट्री थाहा हुनु पर्यो हैन अनि कुन एज ग्रुपको चाइल्ड इन्क्लुड हुन्छ थाहा हुनु पर्यो हैन 2 मन्थ्ससम्म चाहिँ के हाउ यु एसेस अनि 2 to 5 इयर्ससम्म चाहिँ कुन चाहिँ मेन डिजिज 5वटा डिजिज इन्क्लुड भएको थाहा हुनु पर्यो जनरल डेन्जर साइन थाहा हुनु पर्यो अनि हाउ डु ग्रुप इन द येलो रेड एन्ड पिङ्क जोन भन्ने थाहा हुनु पर्यो अनि यसमा के इन्क्लुड छ त नट ओन्ली द 5 डिजिज हैन यसमा तिम्रो न्युट्रिसन इन्क्लुडेड छ किनभने वी हेभ इन्क्लुडेड म्याल न्युट्रिसन हैन अनि तिमीले घर पठायो भने के काउन्सिलिङ गर्छौ त हैन कहिले फर्किन्छौ न्युट्रिसन कसरी दिन्छौ प्री रिफरल ट्रिटमेन्ट के हो हैन घर गएपछि गर्ने ट्रिटमेन्ट के हो सो दिज आर द थिङ ओके मेन एम के हो त we are trying to prevent the under 5 mortality by the common disease by applying this by all the
हेलो 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 सुनिरहेछ खोइ सुनिरहेछ कि छैन भन्नु त तिमीहरूले I'm speaking from mobile. हेलो बोल न खोइ बोलेको सुनेन सो आजको क्लास यति नै हो मैले सबै कुरा भने है सो आइएमसीआई भोलिको हुँदैन सिधियो हैन त्यो उसमा मैले रेकर्ड पठाएको छ तिमीहरु त्यसबाट रेकर्ड हेरे हुन्छ है त ओके